Hello friends, I am Dr. Vibhor Borkar, Pediatric Gastroenterologist, Hepatologist and Liver Transplant Physician working in Mumbai and surrounding area. Today we are going to talk on very important topic. Many of you may not have heard the word, and in many families there can be children suffering from this disease, which is called as celiac disease. Okay, so let's understand how this disease occurs and how to find out or how to recognize the early symptoms of celiac disease and long term how to deal with this. So let's see, what is celiac disease? Now, celiac disease is actually an autoimmune condition. It's not just wheat allergy. What happens here is there is a person who has some tendency to react to the wheat, which is a genetic predisposition. If this person eats a gluten, which is a protein which is present in few grains like wheat, barley or rye. Rye means not mustard. It's a type of grain which is seen in cold countries, may not be seen in India, but this is just one of the grain. So if someone eats this grain which contains a gluten, then your body's immune system reacts with this and damages the intestinal lining. That's how celiac disease happens. So it's not a wheat allergy, it's an autoimmune condition with multi-system effects. So it's not intestine that it damages, its effects are in the entire body. Let's see who are more prone to celiac disease. People who have a family history, means a member who is affected with the celiac disease. So 10% risk is there if your first degree relative is having a celiac disease. Apart from that, other autoimmune conditions like autoimmune thyroiditis, type 1 diabetes mellitus or Down syndrome, IgA deficiency, these conditions increases the risk. However, the prevalence over the globe is around 1 to 1.5%. In India, it's around 1% of the population may be suffering from celiac disease. Regional distribution might vary, like the northern states of India, what we call as the celiac belt of India, they have higher proportion. However, the people who are living in the southern part, they have a less prevalence of celiac disease. It not just because the genes are different, it is also that how much time or how much part our diet is wheat. So majority wheat eating population, they will be more prone to celiac disease. It doesn't mean that wheat is something very bad and you should not eat it. Now let's see what are the symptoms of celiac disease. Celiac disease presents in many ways. The classical symptom which is seen in actually only 40% of the children, it is like having a loose stool, abdominal distension, bloating, child not growing well, having anemia. These are the common symptoms. However, as I mentioned previously, that it is a multi-system disorder. So it can affect many other systems and can just present with that. So that we call as a non-classical presentation, where it can present with bone disease like rickets. It can present with iron deficiency anemia. In adolescent girls, it can present as a delayed puberty, sometimes like pathological fracture, sometimes just with skin diseases. Okay, so these are the varied presentation, and that's why if these symptoms are present, one should have a very low threshold of suspecting celiac disease. Let's see how to diagnose. A simple blood test like TTG-IgA, tissue transglutaminase related immunoglobulin A. This is the blood test which is done, which gives suspicion of celiac disease. Now remember what I have mentioned, gives a suspicion. It's not a confirmation of the disease. Many a times, just on the basis of this test, celiac disease is diagnosed. So I will request not to do this mistake. In Indian scenario, the diagnosis is confirmed by doing endoscopy. The endoscopy is a test where doctor take a endoscope which has a light camera. It goes from the mouth, food pipe, stomach, intestine, and we take a very small piece of small bowel that we call as a biopsy from the duodenum, and it is seen by pathologists under the microscope, and we actually see that yes, the intestines are damaged, and this damage is caused by gluten damage. Then we confirm, okay, this is a celiac disease. So only a just blood test, we do not diagnose it as a celiac disease. Apart from that, when the diagnosis is doubtful, we can do the genetic test like HLA-DQ2, DQA. Again, these are not diagnostic tests. Your doctor will explain you in detail on one-to-one basis how to interpret this test. Other tests like EMA and other tests are also there. Let's not go into details of it. For more information on celiac disease, do not forget to watch part 2 of this video.